I would like just to put on a table an opposing trends that we are seeing as when assessing the different regulation that are have impact on the healthcare sector specifically. So from one perspective, if we look at the EU space, we can see that the focus of the trend is to move in a direction in order to increase and strengthen the interoperability and collaboration. So regulation, or the aim of the common European data space, is exactly to try to, on a sector specific, and we will see later on what has been done on as part of the European health data space. But in any case, quite all the regulation that has been released in the last 1 year, 1.5 years in the EU space is something that move into the direction of, for sure, strengthen the cyber security related piece as they need to, or the getting the possibility even to the end users to get access to what is called the the data that is produced by the so-called connected products or services. So that means the Data Act, or the, as we discussed at the beginning, the artificial intelligence with the UI Act, which is the first comprehensive framework to deal from development, deployment, and usage of AI technology. So all these regulation, we can say that in some way, in a different way, clearly, but moving into this type of direction. Even if we extend the scope and we look at the Apex site, so we can see that even the new global CBRP and the PRP is something that, again, has the aim to consolidate the framework, the certification framework that an organization can demonstrate compliance with, in order to transfer personal data across the globe in a secure way at the end. But on the opposite, there are some regulations, some countries, and I listed some of them into the slide, where for different purposes, for different reasons, one of them is, or the most common one is related to the fact that the health data has been considered more and more a national value data. They are willing to limit the location where the health data can be stored. Even in some countries, they are even imposing that the cloud service provider that are hosting, where we can host the health data, can be specifically qualified. So what we are seeing is exactly these opposing trends, from collaboration, increasing collaboration, but on the opposite side, maybe reducing this type of collaboration, enforcing this limitation on usage of new technologies like the cloud service provider, or either the hosting limit where the data can be stored.